Alcohol and depressants. What you need to know. Alcohol is one of the most commonly consumed substances in the world and can have a wide range of impacts on the body and mind. Many people choose to use alcohol as a form of relaxation or in social settings, but it is important to be aware of its effects. When consuming alcohol, it is important to understand what other substances it may interact with in the body, particularly depressants. A depressant is any substance that slows down the body's activity, resulting in relaxed or drowsy sensations. Alcohol is classified as a depressant, and when consumed in large quantities, it has the potential to cause a person to become intoxicated and exhibit signs of intoxication. It is important to understand the effects of alcohol and its interaction with other substances in order to help make informed decisions about how much and how often alcohol should be consumed. In this post, we will look at the history of alcohol use, how alcohol works as a depressant, and treatment options available if you are having problems. We'll also explore different perspectives on alcohol use and share stories from people who have experienced both the positive and negative effects of alcohol as a depressant. History of alcohol use. Alcoholic beverages have been around for thousands of years, with evidence of it being used by humans in places like ancient Egypt, Mesopotamia, and China. The use of alcohol has had both positive and negative impacts on societies around the world, from providing comfort and relaxation to acting as a social lubricant or numbing pain. In the past, alcoholic beverages have been used for religious or ceremonial purposes, as a form of medicine, or to enhance the flavor of other foods. While some cultures associated alcohol with moral decay, others embraced it as part of an enjoyable lifestyle. In more recent times, alcohol has been used recreationally or as a way to cope with stress and anxiety. No matter what its purpose, the history of alcohol use has a deep impact on societies around the world. Effects of alcohol. Alcohol affects individuals in many ways and can have both positive and negative impacts on behavior and well-being. When talking about the effects of alcohol, it's important to keep in mind the differences between short-term and long-term effects. The short-term effects of alcohol are very noticeable and can range from mild to extreme depending on amount consumed. In the short term, alcohol can cause a sense of relaxation, diminished inhibition, and an overall feeling of euphoria. On the other hand, too much alcohol can also lead to impaired judgment, difficulty focusing, blurred vision, and distorted perception. In some cases, excessive alcohol consumption can even lead to blackouts or passing out. The long-term effects of alcohol can be far more serious. Over time, heavy alcohol use can increase risk for developing chronic diseases, increase the likelihood of liver damage, cause brain damage, and may even raise the risk of certain types of cancers. Additionally, habitual and heavy drinking can lead to depression, anxiety, and relationship issues. It is always important to remember that everyone's body processes alcohol differently, and so it is impossible to make generalized statements about how alcohol can affect you. If you think your drinking habits are putting your health or safety at risk, it is best to seek professional help. The science behind alcohol. Alcohol is a central nervous system depressant. It is produced by the fermentation of sugar or starch and has been around since ancient times. In its pure form, alcohol is a colorless, odorless liquid. When we consume alcohol, it is absorbed by the stomach and small intestine and enters the bloodstream. Once in our bloodstream, it travels to all areas of the body, including the brain. In the brain, alcohol acts on several different pathways that regulate our mood, behavior, and emotions. At low levels, alcohol affects our mood by creating feelings of euphoria and relaxation. However, as the alcohol concentration increases, it starts to impair our judgment, coordination, and reaction time. High levels of alcohol can lead to confusion, drowsiness, unconsciousness, and even coma. The effects of alcohol on the body depend on the amount and frequency of consumption, as well as individual factors such as age, weight, gender, health status, and amount of food consumed. Long-term, heavy drinking can lead to physical dependence and psychological addiction. Alcohol withdrawal symptoms include nausea, vomiting, hand tremors, sweating, anxiety, depression, insomnia, hallucinations, and seizures. Treatment for alcohol addiction involves detoxification, medication, counseling, and lifestyle changes. With the right support, individuals can safely and effectively overcome alcohol addiction. Types of depressants. Depressants are substances which function to slow down activity in the brain and body. This can lead to feelings of relaxation, drowsiness, and even confusion. There are various types of depressants, with alcohol being the most commonly used and abused. Other depressants may include benzodiazepines, barbiturates, some sleep aids, and certain opioids. Prescription drugs, such as benzodiazepines, Xanax Valium, are typically used to treat anxiety or insomnia. These types of depressants can be effective when used as directed. However, they can also cause dependence and addiction. Barbiturates, on the other hand, are sedative hypnotic medications typically prescribed for sleep disorders, anxiety, or seizures. Again, these drugs, while sometimes helpful, can also be habit-forming and should only be taken with careful consideration. Alcohol is a depressant commonly referred to as a downer. It is the most widely used and abused drug in the world and can have both short-term and long-term effects on one's health and well-being. In the short term, alcohol can lead to decreased inhibitions, slurred speech, decreased coordination, and slowed reaction times. Long-term, it can lead to increased risk of developing certain cancers, liver and heart disease, mental health issues, and brain changes. It is important to understand the potential risks associated with the use of depressants and to seek professional help if needed. If you think you or someone you know may be struggling with an addiction to alcohol or drugs, please seek out help and resources in your community. Withdrawal symptoms. Alcohol withdrawal symptoms can be both physical and psychological. Common physical symptoms include nausea, sweating, headaches, and an increased heart rate. Psychological withdrawal symptoms can be more severe. They include anxiety, irritability, depression, insomnia, confusion, and sometimes even hallucinations. These symptoms generally begin within several hours of the last drink, but may take longer or even days to appear. Treatment for alcohol withdrawal is available and can help ease the discomfort and potential danger of going through the process alone. Medical detoxification is one type of treatment that can help individuals manage their withdrawal symptoms in a safe, controlled environment. During detox, patients will be monitored around the clock by medical professionals who can assist them in managing their cravings and withdrawal symptoms. Other treatments for alcohol withdrawal may include prescriptions to manage anxiety or depressive symptoms, individual counseling, group therapy, and mindfulness-based meditation techniques. Treatment programs should be tailored to meet the individual needs of the patient and often involve a combination of therapies. Stories from people who have used alcohol as a depressant. Alcohol is a depressant drug, meaning it can have both positive and negative effects on the body and mind. Beyond the medical research and scientific facts, there are real people who have experienced firsthand the effects of using alcohol as a depressant. Here are some stories from individuals who have used alcohol in this way. Alicia. Alicia had been using alcohol to help her cope with the stress of college life for years. She said that in moderation, it made her feel relaxed and carefree. However, when her drinking became more frequent, she found that it had the opposite effect, becoming overwhelmed and depressed. Miriam. For Miriam, alcohol was a way to cope with her depression and anxiety. She said that it gave her courage and comfort while she was struggling with dark thoughts. Despite the initial feeling of release, Miriam found that excessive drinking created a cycle of depression that was difficult to break. Caleb. Caleb began drinking as a way to escape his difficult home life. He felt that it would make his problems disappear and give him the confidence he lacked in certain social situations. Eventually, he began to rely on alcohol more and more, and it exacerbated his feelings of depression and loneliness. The stories of Alicia, Miriam, and Caleb demonstrate how alcohol can be both a blessing and a curse. As a depressant, it can provide relief from stress or anxiety at first, but can ultimately result in a worsening of one's mental health. Summary and conclusions. In this post, we looked at alcohol and depressants. We discussed their history of use, the effects they can have on one's body and mind, and the types of depressants available on the market. We also examined how alcohol works as a depressant, the withdrawal symptoms it can potentially cause, and the different treatment options available for individuals struggling with an alcohol problem. From the data provided, we can conclude that while alcohol can temporarily provide a feeling of relaxation and pleasure, it can also have serious long-term effects on one's mental and physical health. Therefore, it is important to monitor the amount of alcohol one consumes and to seek help when needed. Although it can be difficult to overcome an addiction, there are many treatment options available to those seeking help. The stories shared by people who have used alcohol as a depressant can provide much-needed insight and guidance for those who are battling an addiction. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief.